There's an alarming increase in the number of infections that are resistant to treatment, and these are infections caused by superbugs. The estimates are that by 2030, the number of deaths attributable to these types of infections will exceed the number of deaths due to cancer. In Ohio State, we have one of the few teams in the world that can solve the problem by targeting research and education efforts at the intersection of humans, animals, plants, and the environment. And the team is really the Infectious Disease Institute and our 250-some faculty that span 11 colleges and Nationwide Children's Hospital. It's incredible. This is one of the few universities actually in the world where you have all of these colleges and the associated disciplines in one physical location that's walkable. I strongly believe that Ohio State is truly unique in terms of the ability to address this challenge. It's not a small challenge, it's a big challenge. But if anybody can do it, I believe we can.
Please welcome Dr. Michael Oglesby.
I have a daughter, Alex, and when she was in high school, she had a friend and a classmate that awoke one morning with a sore thigh. Her friend had been playing basketball the day before and just assumed that that soreness was due to a sprained muscle. But over the course of the next 2 days, that soreness increased, and he went to a hospital and learned that the problem was actually an infection caused by a bacterium that was resistant to most drugs. It was a superbug, a bacterium that we know as methicillin-resistant Staph aureus, or MRSA. Physicians were able to save Alex's friend, but drugs alone were not the solution. It required the amputation of not one, but both of his legs. Drug-resistant infections are increasing at an alarming rate, and they're not just caused by bacteria. They're caused by fungi, by viruses, and by protozoa. In 2018, the number of deaths attributed to infections that were resistant to treatment were approximately 700,000 worldwide. The Centers for Disease Control and Prevention and the World Health Organization predict that if unchecked, the number of deaths will hit 10 million by 2050, exceeding deaths attributable to cancer. This problem is complex. And complex problems require complex solutions. It requires a team approach. It requires offense to really address the problem at its origin, and it requires a strong defense to address the problem when it arises. At Ohio State, we actually have the team that can eliminate that threat. And we can do this by drawing upon the unprecedented breadth of expertise on our team. And that team is the Infectious Diseases Institute. With over 250 faculty, over 400 members drawing from 11 colleges and Nationwide Children's Hospital, we can attack the problem at every level. I'll start with stewardship. When you use a drug to treat an infection, if you're using the wrong drug or the wrong dose, you can be encouraging the rise of a superbug. How many of you have gone to a physician and the diagnosis is, oh, you have a virus infection of your upper respiratory tract, I'm going to prescribe antibiotics. Well, you know that antibiotics are doing nothing for the virus, right? And maybe the course of antibiotics was an 8-day course, but after 2 days, you're feeling great, so you stop taking the antibiotic. You have just contributed to the rise of a superbug. And that drug-resistant microbe is not a threat only to you, it's a threat to everyone around you. So with stewardship, we establish programs that define guidelines for appropriate use of these invaluable drugs that we have. And in hospital settings, we can actually enforce those guidelines. We've established stewardship programs in the Wexner Medical Center. We've recently extended that to the Veterinary Medical Center and the College of Veterinary Medicine. We're extending best practices into agriculture. And this year, we were designated the North American Reference Center for Antimicrobial Resistance by the Food and Agricultural Organization of the United Nations. And that was because of our ability to see this holistically and actually have impact on the problem. We also draw on our colleagues in nursing and the social sciences to understand human behaviors that both contribute to the problem and can also be part of the solution. Surveillance. Where are these organisms? Where are these drug-resistant organisms? Are our stewardship efforts having any effect, or are they having the desired effect? What are the reservoirs? What are the roles of humans, animals, plants, and the environment in their circulation? Is it possible that treatment plants processing hospital wastewater are releasing microbial genes into the environment that give rise to superbugs in our water systems that can then spread into our food systems that can then spread to animals and people? And research by our group says yes. And think about that for a moment. It's sobering. We draw upon our specialists in public health and in the environmental sciences to identify ways in which we can disrupt that chain. Knowledge. This is really about knowing the opponent. When you isolate that drug-resistant organism, can you actually identify the mechanism by which it's resisting treatment? Because that's the first step in developing countermeasures. And here we draw upon our specialists in microbiology, in genomics, and our data scientists. And finally, for those situations where we are faced with an infection, a drug-resistant infection, how can we get our head around this? How can we use our existing drugs most effectively? And how can we draw upon our colleagues in pharmacology to develop new drugs, new ways of using drugs more effectively? We draw upon our colleagues in engineering to develop biosensors so that we can make the best diagnosis at the earliest possible time so that the treatment we start is appropriate to the organism that's infecting the individual. We have members in engineering that are also developing alternatives to the use of drugs. Imagine bandaging materials that conduct electrical currents that actually are capable of killing microbes. We have microbiologists that are looking at the role of beneficial microbes that can actually push out superbugs. And so really the approach is multifaceted. We have the team, and we know how to solve the problem. Where we can benefit through further investment are in people. That's not just faculty, that's staff, and that's students. And by these investments in people, we can accelerate getting to the solution to the problem. Getting to that solution within your lifetime and before this problem gets out of hand. And a win is never having a friend, a classmate that loses life or limb to a drug-resistant infection. It's a world free from the threat of superbugs. I must be right on time.
Great job. You weren't nervous, were you?
No.
No, easy as pie. Who has a question for Dr. Oglesby? That was a big topic, so somebody's got a question out there. I can tell they're thinking about it. Dr. Osborne down here does. Just a moment.
I was wondering, the stewardship part made me think in particular, this is such a big global problem. Obviously, there are dimensions that are beyond the reach of what the 250 plus faculty are doing with you. Are you partnering like on things like how to improve appropriate writing of prescriptions and all of those things? Can you just talk about your partnering facets?
Partnering, how do we expand our reach? We're actively engaged in outreach in influencing, or I should say educating, and thus influencing countries in the Caribbean, Central America, South America, and Eastern Africa on proper use of antimicrobials, how to survey effectively to know what the impacts are, and engaging local governments in basically coming on board and seeing the benefit. Because we know there are some parts of the world where there's free access to these antimicrobial drugs, and it's very easy for them to just throw them at the problem, not even knowing what they're treating. And so our efforts are directed at showing them the true cost of that failure in stewardship.
I guess my question in this area is, what's the role or the approach in terms of prevention versus treatment?
Yeah. Prevention versus treatment. Prevention, that's a great question. Prevention is everything. And one part that I didn't pull out is really the outreach, the policy efforts, the addressing human behaviors that are contributing to the problem is everything. It can be as simple as vaccinate your children against vaccine-preventable diseases, because oftentimes with a viral infection of the respiratory tract, the problem is the secondary bacterial infection where you're now treating with antibiotics. Getting back to this environmental piece, I'll be very interested to seeing how we can actually get our hands on, I mentioned the wastewater treatment plants releasing these microbial genes. There may be a point in which we can disrupt the release of these genes that are giving rise to drug-resistant microbes in our water systems. So there are multiple points I think we can attack to disrupt the problem, but you're absolutely right. It's somewhat why I presented treatment at the end, because that part of defense is the part we need to be effective, but we really want to be on those 3 upstream components.
Any others for Dr. Oglesby? Okay, another round of applause.
Thank you.